who approaches a dental surgeon for treatment usually demands a realistic replacement of the lost hard and soft tissue, and it becomes impossible to dental surgeons to deal with patients who have this unrealistic expectations about the replacement if we are unable to assess the mental attitude of the patient. The adoption of healthy behavior of pattern to improve and maintain health are at the center of health promotion strategies. And to unfold this veracities of patients' attitude and behavior, we have amidst us an eminent personality, Dr. Fayaz Pasha, sir. The presence of a renowned personality always brings with it a great deal of enthusiasm and value to the event. I take this opportunity to introduce and welcome our speaker for today, Dr. Fayaz Pasha, sir, and the panelist member, Dr. Muhammad Hilal, sir. To introduce Fayaz sir. Fayaz sir has graduated Bachelor's in Dental Surgery in the year 2003 as a best outgoing student of the batch, and MDS in the year 2006 from BS Dental College. Sir is a diplomat of International Congress of Oral Implantology and member of American Academy of Implant Dentistry. Sir has worked as an assistant professor in VS Dental College for the year 2006 to 2015. And he has delivered many guest lectures and conducted numerous workshops training dentists in prosthodontists and in dental implantology. Sir has publications in various journals, including the Journal of Prosthodontics, and also upholds 2 practices in Bangalore. So presently, Sir is working as specialist prosthodontist and implantologist in NMC Healthcare, UAE. A warm welcome to you, sir. I also take this opportunity to welcome Dr. Hilal, sir. Sir has completed his master's in dental surgery and prosthodontics from RV Dental College and currently working as a professor in R. Ambedkar College in Department of Prosthodontics, Bangalore. Sir has about 25 and plus publication and also a co-author of book Pediatric Maxillofacial Trauma in Lambert publication. A warm welcome to you, sir. I now request Dr. Fayaz, sir, to please take over the session.
Assalamu alaikum, all of you. Thank you so much, Dr. Neha Kausar, for this wonderful introduction. And also, very good morning. I think it's almost afternoon in Bangalore. It's 12 past. So it's very nice. And thank you so much again for Global Dental Professional team who have organized this webinars. So starting from Asim Basha sir, Dr. Nair, Dr. Ali, Dr. Nadim, everybody, Dr. Salman, Shiraz, everybody are doing a fabulous job in arranging all this. And my dear friend, Dr. Hilal, very happy to see him here today with this panel. So today's topic, I would like to discuss about this basic topic. Actually, it's all about, you know, the patient's attitude and behavior, what we get in dental office. So we do treat dental patients for different dental problems, but it was going in the mind that seeing previous webinars that we should also touch into this topic where we are going to look into what type of patients we treat and how can we classify them based on their behavior and mental attitude. So this is what about all I'm going to speak in today's topic. And also at the end, I'll be showing 3 to 4 cases so that we have some, difficult situations where we can see whether those problems or the complaints or the expectations of the patients are realistic or unrealistic. So before I start today's presentation, I would like to give condolences to 2 of the eminent people who just passed away. One is, we know that Puneet Rajkumar, Dr. Rajkumar's son, who just passed away 2 days back, and whole of the state is mourning. And just today morning, they had a final rite. So, and also one more eminent dentist, Dr. Madhav Murthy, if you know, who is known in the world of aesthetic dentistry. He studied from GDC Mumbai. He had a practice in Bangalore and heard his lecture on aesthetic dentistry. And he was also working for a long time for 3M. So very senior dentist, he also passed away. These are the 2 sad news. And as dentists and as people from Karnataka, we should, give condolences and hope their soul rests in peace. So with this, let's start today's topic. So today I'm going to speak about few aims and objectives of the topic, which are following. So I'll start with a brief introduction, then let's go into patient classification, understanding patient needs, patient types, classification, then managing exacting or indifferent patients, then patients, then practice management, and based on that, how we can classify patient types, then challenging aesthetic and functional problems, managing realistic demands of patients, conclusion, and references. So before I begin the first slide, so we can have an interactive session. Dr. Hilal is there. Dr. Neha is there. They can stop me in between anytime if they wish to stop me and ask me some question or discuss, or we can take up questions at the end. So the first slide, which you have put, like history repeats. We know that dentistry dates back to 2000, 3000 years. We have a lot of history about dentistry, and we have been treating dentists as dentists to our patients, in different scenarios. So every time we are doing the treatment in different, ways, we know the techniques we learn. So all those things, these are the few pictures which were there, 100 years back, 150 years back, where different type of patients and in different parts of the world, how the dentistry is practiced. But over a period of time, in the 18th and 19th century, we saw an era of industrialization, where we witnessed a rapid industrialization. So this led to the change of agriculture based economy into industrial economy, and rural societies transformed into urban societies. So the Second World War is a very, very important event in the history of mankind. And after the Second World War, we had a phase which was very, very peaceful throughout the world, especially in the Europe and the US and other parts of the world, which followed. And in this part of the period, we have something called baby boomers. So I'm going to tell you why these baby boomers are important in this present era. So the baby boomer, we know that between 1946 to 1964, a person who was born, baby boomer. So baby boomer, population, that substantial portion of the world's population, especially in developed nations. So increase in population and industrialization led to the requirement of high health demands with better understanding science, better understanding of health sciences than ever before. So if you look into these charts, we have, how the baby boomers have, increased in population, especially the bottom graph, if you see, there is a prediction from 1900 till 2030. So we can see how many people, or the life expectancy of people, have increased and how many baby boomers are going to live. So especially 65 plus, the elderly population is going to increase in substantial number. So that means, so we have more of elderly patients, in our society, so who needs healthcare facilities. So that's where we are going to treat most of the people, and we are going to see a lot of dental problems in this population. And these baby boomers are almost now 65 plus, and we are going to have these kind of patients a lot in our practice. I'm very sure all of you, or each one of you, must be, having these kind of patients in your practices where they need, geriatric requirements of the dental practice, things like that. Now we have an era of globalization. So after 80s, 90s, I'm very sure those who are already crossed 40 years, 50 years now in their age, and who are practicing more than over 20 years, have seen a very, very vast change in improvements in technology, and the ease of travel which has happened, the internet, social media, digital and virtual platforms which have come. All these have led us to change our, the way we practice the technology and things like that. Though the basic science remains the same, but still, hello? Excuse me?
No, Fayaz, continue. I think there's some
Yeah.
disturbance.
So, this has led to, things uh, have changed a lot. The way we think, the way we practice, and way we treat our patients, and the patients also know. So now, what has happened with all this is we have our patients who are like very well informed today. They are more educated. They know about the procedure. They can easily identify who's a good dentist, who's a bad dentist. It's not the way we used to practice in 80s, 90s, and things like that. Because of social media and things like that, things have changed a lot. Now, at the same time, as we are healthcare professionals, we are dentists, so we should also understand what type of patients we are going to treat. It's just not the mouth we are treating. There is a very famous statement which I remember now, like meet the mind of the patient before you meet the mouth. So we have to understand what type of patients we are going to deal with. So we have to classify them and identify them. And based on that, we can also have an idea of what kind of prognosis we are going to have with kind of patients. We are not blindly taking up the patient and doing the treatment and things like that. So everything has changed. We have to be more careful because the legal system has come, social media is there. So everything, is very, very transparent. So we have to be protected, professionally. So all these things has, given us the idea of how we can classify our patients and how to treat them. So I am putting this slide where we have a House classification, which is a very, very basic classification. First, earlier it was given in 1954, and then later in 2003 it was modified. So, patient basic four types, what we classify, especially for completely edentulous cases, is into four categories. Again, I'm going to see into the newer classification, and also I'm going to have some more classification where we can see the patients who come for other dental problems. So in this classification, let's understand there are four types. That is philosophical patients, exacting or hypocritical patients, hysterical patients, indifferent patients. These are the four types of basic patients which were given. It's very easy to understand. So we have other classifications like cooperative patient, uncooperative patient. Again, in cooperative patient, we have some patients, subclassifications like they are moderate or they are apprehensive. Some patients will be apprehensive maybe because they're anxious, they're frightened, they're obsessive, or they're chronic complainers or self-conscious and things like that. Then we have one more classification, which is like ideal, submitter, reluctant, indifferent, and resistant patient. So again, this is a modified or the new version of House classification. But we are going to look into the first classification first in detail. Then I'm going into other classifications very briefly. So based on patient's mental attitude, that is psychology, it is classified under four possible groups: philosophical, exacting, hysterical, and different. Now we are going to look what kind of patients we do get in our practice and what is the percentage of these patients according to statistics. So we know that philosophical patients are best patients. They understand limitations of the treatment. They cooperate with the treatment process. They follow instructions. So philosophical patients, they are exacting. Sorry, this slide, yeah. We know that they are the best patients for us. They understand limitations of treatment. They are cooperative, and they understand the whole process. They follow instructions. They will not fight for the fees, and they are easy to do the treatment. So around 60 to 70% of patients whom we get in our practices, they are philosophical patients. That's why still our practices are peaceful and we do everything, very patiently. Now the problem starts with the last 20 or 30% of patients we get. So next category is like exacting patients. Exacting patients generally, they are well educated, well informed, but they doubt on doctor's ability and treatment. They ask many questions. These are very, very difficult patients, and they intervene in every step of treatment. But once they're satisfied, they are the patients who gives you publicity to the doctors. So you have to be extremely careful these patients, because especially now, thanks to Google, thanks to social media, they are very well informed. They know what treatment they're going to get. They'll do all the research and come to you. They'll find out about you also, what qualifications you have, what treatment you can do. But at the end, once you show your knowledge, show your skill, and address all the problems, definitely they'll be your very, very good patients. So 20 to 30% are these are exacting patients who come into your practice. So next comes the next category, there's the hysterical patients. These are the very, very dangerous patients. We should I wish we should not get these kind of patients into the practices, because they want treatment in their own way. They'll never listen to you. They'll never follow instructions. They generally come for you window shopping. They give instructions to doctors in every step of treatment. And most of them, generally, they'll land up with bad prognosis. So these are the very, very, kind of patients whom you don't want to see in your office. So these are around 5 to 10% of patients who are hysterical patients. So finally, we have the last group, indifferent patients. Indifferent patients are not bothered about the treatment. They never bother to follow instruction. They're not about, bothered about their looks, or they just come to doctor because they have a course or some relative or parents. They bring them, and they're generally accompanied by a caregiver. And say less than 2 to 3% of our practice is based on the indifferent patient. So whatever the patient classifications I'm doing, this is for the elderly. Now in the subsequent slides, we are going to have some classification which will apply to everybody. But I am not speaking about any classification on child patients, because we are not dealing with pediatric patients here. That's a different topic altogether. So now patient types, if you take the graph, simple graph, as I said, philosophical around 6 to 70%, exacting we have around 20%, and hysterical around 5% to 10%, and indifferent less than 5%. So this is how the graph, and we look into the prognosis, what kind of prognosis we are going to have. So we'll have a philosophical patient who will have a prognosis generally good to fair, then exacting, they'll also have good to fair prognosis. The hysterical patient will have fair to poor prognosis, and even different patients, because they're just not bothered, they don't follow your instructions, and they just don't cooperate with you. So generally their prognosis is poor. So the hysterical patients and the indifferent patients, these are the kind of patients generally we try and avoid doing any treatment to them, because it will be a time consuming, whatever the procedures we do, it will be a waste of resources, their time, our time, and finally land up in fair or poor prognosis. So it is always advisable to speak to your patients, understand what type of patients they are, and take the consent, and see, especially if the long treatment is there, see how much they can participate with you in the treatment. Then you can classify your patients and take accordingly. So it is absolutely no problem if you refuse a patient when the patient is not cooperating with you, and things like that. So it'll make your life easy. So this is about the classification, basic classification. Next, we have something
Sir,
called cooperative and uncooperative patients.
sir,
Yes.
I have a
Yes.
doubt. Sir, can this philosophical patients turn out to be exacting patient?
Yes, they can be,
Because when you're
because
classifying the patients, now for a particular dentist, the patient would have been philosophical, but the same can when he's going to another dentist, he can be classified as exacting. So is it like it does change, sir?
yes, it does change, because if the patient has a bad history of dental treatment, so generally they start understanding what went wrong. And in the process of understanding all this, if they had these episodes repeatedly, that's when the problem starts, and they'll not stop believing the dentist. And a new dentist they go, and they start doubting the new dentist, what he's going to do. So that's when they become a bit apprehensive, and they become a little exacting. Trust me, a lot of patients come to us, and the dentist only give them the idea how treatment has gone bad with the previous dentist. This is the big problem with the dentist. So most of the patients will not know, but once they go, they give some ideas and things like that. A lot of philosophical patients are converted into exacting patients, because because of some treatment has gone wrong, or something has gone wrong, or some infections happen, or repeat infections happen. Something will go wrong, and that's when they turn out to be like this. But Exacting patients, yes, we can treat them carefully, addressing their problems. The problem really comes with the hysterical patients or indifferent patients who are really, really difficult to deal with. So those two groups you have to be careful. But as you asked, philosophical can become exacting patient, if their problems are not addressed and if they get a little apprehensive with a bad dental history. So we'll
One
continue.
more question, sir. So
Yeah,
nowadays, all the patients, whoever goes to the surgeon, they do Google themselves before they are coming. So how,
yeah.
which category would we decide which patient, like those such patients, under
They are
what
exacting
category shall we put
patients.
it up, sir?
Yeah, they are exacting patients. See, it's all about having a knowledge about everything is okay, fine. So once they come into your practice and how they show up to you, that's what will decide or classify these kind of patients. So if they have a Google knowledge, it's absolutely fine. Even a philosophical patient, he's well informed, he comes, but he cooperates with you, he understands what you speak. Philosophical patient, they understand basically the limitation of the treatment. They understand if there is any complication which can happen. They understand the success rate. They understand it can fail also. So these are the philosophical patients who really understand everything and go with you. So the exacting patients, they have the knowledge, but at the same time, they try to show off their knowledge, like they know it. So they try and ask what material you use, what procedure you do. If you do that procedure, what will happen? So these are the kind of, they basically come into your procedure or exactly what, when you're doing the treatment, they ask you multiple questions in each step. And also before starting the treatment, they ask you many steps. So these are the people who argue or ask questions because maybe they are a little apprehensive or they want to know or they want in their way exacting like the way they want. So that's where those kind of patients. Uh, the Google knowledge or whatever the social media knowledge is independent of what kind of classification we have. Shall I continue?
Yes, sir. Thank you so much.
So cooperative patients and uncooperative patients we have again cooperative and cooperative, but some patients will be apprehensive because they'll be anxious, frightened, obsessive, and then some patients will be chronic complainers and self-conscious. So these are the self-explaining terms, and other classification is uncooperative. So there is a new classification. We call it as new House classification. In this, we have 5 types of patients. This is a very, very good classification, which is modified. So we have like an ideal, submitter, reluctant, indifferent, and resistant patient. The thing which I marked at the bottom is a resistant patient, that difficult patients. So we have engagement and willingness to submit. First category is engagement. It is the when a patient comes to you, they'll have some idea about a dentist. If a patient coming to me, they'll have some idea about Dr. Fayaz. So they will they Google it. They have some kind of, they already have a mindset about me before they come to me. And once I present a treatment plan, once I try to engage them, or that's when they behave differently, like willingness to submit, themselves or the trust they have on my treatment plan. This is what these two categories. For example, if you take an ideal patient, so ideal patient will see, they'll tell, see, I see you're the professional who's in position to help me and accept whatever, you do in your capacity. That's what kind of, ideal mindset they'll have. But once I present a treatment plan, they'll say that, like what you say makes sense to me, but there are some questions I would appreciate being answered. So I need to answer the questions, and once I satisfy their uh, uh, questions and tell them all the solutions for their problem, then they'll go for the treatment. They trust me. Then we have another category called submitter. Submitter patients, they are like your fans. Like they say, you are the best dentist around here and I've ever had. I admire you, idealize you, think of you in most of the glowing terms. These are like your fans. They really come to you and thinking that you are the best doctor in the town. So once you give a plan, they'll say, you know everything and will never make an error on me. So therefore, I submit whatever you suggest without a question. These are like very easygoing patients in your clinic. So they come to you because of you and they like you so much. So reluctant patients. So these are the kind of patients who like uh, are kind of patients who have a mindset like they have some reluctance, like they think like please don't take this personally, but just don't think that you or any dentist is going to be able to help me, because they think their teeth are only not good, their fate is not good. So when you give a plan, they say like, it isn't I distrust you, but to my destiny, nothing ever works out in my life. Therefore, I will reluctantly follow instructions, but I doubt this will work. So they have some kind of problems with themselves or depression. They're dealing with other problems. So that's where they are not really cooperative with you, but they try and follow your instructions. We have indifferent patients. So they are like, uh, they come and they say with a mindset that I won't even give a second thought, whatever, I'm going to speak. But once I give a plan, so you're a dentist like any other dentist, what does it matter whom I see? I listen and follow instructions. I guess it for now. Like they are kind of another level of patients. The problem comes with the resistant patients, where they are very, very difficult patients. They have a very, very bad negative attitude about doctors or dentists. Like they come with attitude like, or they have a mindset like, they say you all dentists are patients to listen whatever you say. If you think I listen to you, whatever you say, and you're sadly mistaken. So prepare to challenge. They ask you questions and things like that, but they're not going to listen to you. So if you give a plan or a big plan or something like that, they say you have to be crazy if you think I'm going to do this treatment with you. So I need to grill you to determine that you're not a charlatan. So these are all the patients who, are very, very difficult to manage, especially the resistant patients. So we'll have a very, very tough time dealing with them. So we have something called some classification based on dental practice management. So we know the dental practice management is all about 3Ms: marketing, management of practice, and mastering. That's knowledge and skills. I'm not going into details of dental practice management today because it's a separate topic, but we have some classifications, some type of patients on whom, we can classify patients. In this category, we have 5 patients. So this is basically like how much, what kind of treatment they take and how much they can pay us. It's all about, economics and how nice they are and things like that. So it's based on the practice management. We have event-driven patient. So event-driven patients, they come only when they have the problem. So when it is absolutely necessary and they arrive to you to just like must fix it mindset. So if they have pain, they come to you for the root canal. That's all. Otherwise they think their teeth are fine and everything. They're just not bothered about dental hygiene or things like that. So event driven patient, most of the patient who comes to us with pain, event driven patients. So we have another category called reactive patients. Reactive patients are those who understand the need for regular hygiene and exams, but for one or the other reason, they participate in a limited way. These kind of patients will have problem financially or things like that, or they're busy, but they understand, they know that it is important, but they'll not get the time, or they just can't come to the dental checkups regularly. These kind of patients. So we have something like proactive patients. They are like bread and butter of your patient base, the proactive patients. Why? Because they take their oral health very seriously. They keep up additional appointments. They keep up all the appointments, the complete treatment that they accept, and they tend to be very focused on their, insurance and economic factors and help in prioritizing the treatment needs. Means they really plan well everything about their health. They take care of their general health, dental health. They come to you, and these are the kind of patients we really like, who come to us and have regular checkups and the treatment and things like that. So we have something called next level patient, discretionary patients. These are like, they are ready to look beyond the tooth-based care, and they're ready to invest in aesthetic treatments. So especially here in UAE, in Dubai, Sharjah, Abu Dhabi, everywhere, we do something called Hollywood Smile. It's very, very famous. Though the teeth, everything are very nice. Even after the orthodontic treatment, all the teeth are aligned nicely. They just want to put bleach shade and do a complete, have that white shining smile. So these people often self-identify after they have been influenced, generally by a friend, or they see smile makeover on the social media or something like that, or if they have some wedding function like that. These are discretionary patients who just come for aesthetic needs. They have good teeth, everything, but they want to improve on it. We have finally something called regenerative patients, like they are dentist dream patients, because it's like they want the best care option and they're willing to invest very big for making their oral health back to normal life, like full mouth rehab cases we do. So these are the kind of patients who really pay you well, and they come to you regularly. They'll be there with you for a very long time. They take big treatments and all those things. These are the 5 categories which we have based on the patient types, based on clinical management, practice management. Now, when we come to difficult patients, we have one classification, which is given 3 types of patients. One is reactive, another one is forgetful, these are the fearful. Now, I am very sure each dentist who's practicing would have had a experience with bad patients. Even though we see 10 patients, 20 patients in a day, if one patient comes and spoils your mood, argues with you, the whole day goes bad. And you go back home with a very, very bad mood because one patient or 2 patients, they just irritate you. So we have to be very careful dealing with the difficult patients. So we have to classify the patients before we take up the practice. And if there is a hysterical or indifferent patients, I again say it's always better to avoid them. So difficult patient types based on again practice management, we have reactive, forgetful, fearful. Reactive patient, they come once in blue moon to your practice only when pain or sensitivity is advised. And definitely they'll have financial constraints. For example, they come to you with a lot of pain. Once you open the access cavity and relieve the pain, they'll never come back to you for the next procedure. So we encounter patients in our practices. They are reactive patients. Forgetful patients. Some patients not bothered, they miss appointments, or even you try and give them the regular calls, they're just not bothered about the appointment. So we have to manage them by reminding them or by educating them about the dental problems they have, how serious it can get. Finally, we have something called fearful patients. So fear of dental treatment, sound and instrument, they just don't like that environment. So they don't want to come there. So please manage them by providing calm and relaxing environment. So the fearful patients are always also will be there who are really scared, especially the extraction when it comes, or wisdom to surgeries it comes, and other procedures, surgical procedures, or procedures having anesthesia and things like that. So they'll have a lot of fear. We don't know what kind of fear they have. So we have to be really careful with them and manage them accordingly. So this is about the difficult patients. So when I look and summarize everything, so I saw more than 20, 22 type of different patients in the practice. So this is all the 4 or 5 or 6 classifications which I just discussed. These are all the different patients. And I was amazed to see what kind of patients we can get into a practice and how to manage them, based starting from the basic classification, completely edentulous, then coming into the cooperative and cooperative patients, then the ideal submitter, reluctant, indifferent, and resistant patients, then based on uh, the kind of patient we have based on the practice management system, and the difficult patients, the reactive, forgetful, and fearful, the difficult patients in our practices. So this is all about the patient management. So I think I've covered uh, whatever the classifications which were available, and I have covered it very briefly. But the next step comes sometimes some clinical situations which we can think, are they problems are realistic or unrealistic? Are they achievable or not achievable? These are the kind of things. So I would like to finish my presentation with 3 to 4 different difficult patients, probably, or difficult clinical situations with kind of patients I had, and close this today's presentation for discussion. So challenging patients and clinical situations. So this is one first patient which we had, I think long back, maybe 12 years back. Her main complaint was she wanted teeth like her natural teeth. She didn't wanted a pink denture based material in a complete denture. So this was the kind of situation she had put across, and we wanted to see what we can do. So we came out with a small transparent aesthetic dentures so that we can see that whether her problem or her complaint or her expectation is realistic or unrealistic. It was realistic. We could able to achieve using a heat cure clear acrylic resin and also modifying or doing characterization about the teeth. So how it looks something like this. So you do a bit of characterization on the teeth and try and give a very transparent base so that you can satisfy her demand. So when she puts on the mouth, it looks like that. So this is one tooth is purposely made longer, one is shorter, and there is a black tinge which you can see a shadow inside the denture base, which gives a very natural appearance. So these are like transparent acrylic dentures. So they look very, very natural and it works really well. So this is a realistic expectation patient had, especially in complete dentures when we deal with them. So yes, still we can go ahead and treat such patients, if the demand is realistic and we have a skill to look into that. So this is the final picture we can see. So this is about the transparent complete dentures for a patient who wanted a complete, very, very natural looking aesthetic without the visibility of the pink denture base. Next comes the case. This is the transparent denture. This is the before and after. Next comes a case where we have a situation, patient comes to us with a failing root canal treatment. Here you can see the tooth number 10, that is the upper second quadrant lateral incisor is failing there. So we have the radiograph there, so which has been fractured, where at the CG junction. So this tooth has to go for the extraction. But the patient who are high demanding would like to have some immediate solutions. So where we can do all the procedure in the same day, like the extraction, the placement, and replacement of the tooth in the same day. So we famously call it as tooth in a day. So yes, the demand is there. The expectations realistic. Yes, definitely we can deal with such patients by just quickly doing a same day tooth. So you remove the crown and you look into the tooth there. So there is no way we can restore this tooth. So we do traumatic extraction. The extracted tooth is there. And we are going to place an implant there. And we are going to have a tooth immediately. This is the before and after. The same implantation, immediate implantation with immediate loading. This is about a patient who's walking in and having expectation to have a quick solution with the same day, having replacing the tooth and sending him back with a new tooth. So this realistic expectation also can be met by doing this procedure. So these are the kind of patients who are exacting type of patients. They come with a lot of knowledge. They would have done the research. And only thing is you have to give them exactly what they're asking if you feel it, the demand is realistic. Next come finally a case report I'm showing here about a 13-year-old girl, child, and where she had fell from the bed and she had lost this tooth around 72 hours. That's 3 days back when she met me in 2013. And she had missed this tooth. I mean, she had this tooth which is missing. So this was the tooth which was ours and she got it back, but it was more than 72, 3 days, 72 hours. But there was a socket and everything like that. So in this case, so we plan to place an implant and use her own tooth, like an acrylic shell. We cut the tooth, the crown part, and made like a veneer and use the same tooth because the tooth was good. There was no problem with the tooth. So this is how it was modified. So implant is placed. This is a 5 to 13 Nobel Replace Select implant, which was placed into the socket. And it just goes there, sits there, because the socket was already present. It was very, very minimal instrumentation and socket preparation there. So osteotomy preparations were minimal, and implant was placed there, and immediately the abutment was placed. It was modified, it was milled, and this is placed. So this is a using the same tooth, thinking a little out of the box and using the patient's own tooth and giving that patient, 13-year-old girl, her own tooth. And it's been now, I think, 6 or 7 years. The tooth is still not discolored. Been following it up. I saw her in 2019. So still the tooth is working, and she had got so much of confidence that time, and it is still working. And I have told them that someday she has to replace with a more permanent crown, maybe zirconium. So this is how we can definitely modify some treatment plans according to the expectations they have and still give a very, very good result. So this case is I have put because it's a 13-year-old girl. Now she must be around definitely 2021, but the things really worked. And sometimes we think few things are controversial, but still, if we know and have a proper scientific backing, the skill level and things like that, definitely we can go ahead and do some procedures which will give us the good result. So this is about this case. And finally, this is the final aesthetic outcome of the same case, the day we did the implant and put the tooth. And finally, I'll show this case. Sometimes you have to think out of the box. Means a patient had come to VS Dental College when I was working. He had come for a dental treatment. Actually, I was supposed to do a crown, but I saw his eye. There was a missing right eye. The eyelids were intact, and due to disuse atrophy, they were very tight and they are free of pathology. So being in prosthodontics and maxillofacial prosthodontics, we do learn in our curriculum. We thought we'll make a custom-made ocular prosthesis. This is a custom tray we made. This is the final impression. We have used light body and medium body there. And this is the master cast, which is a split cast, upper and lower portions you can see. And this is the eye shell, which was selected. So eye shell, which is matching on his left eye. And this is small flask, which was used for acrylization and acrylize. This is the finished prosthesis, and see the before and after. Once we put this small ocular prosthesis into eyes, his eyes opened up, and this is how he looked. So this is just a dental treatment he had come, but because of the skill we had and the maxillofacial prosthesis where we do extraoral prosthesis, so we were able to, habilitate him. First time he got a eye on his right side, and he's been using it. I think it's been now more than 15 years. It's been there. So that's how sometimes small things can definitely way the quality of life they have and things like that. Definitely would have been having a good life. So these are the kind of things which we can do in our practices when we have a different type of patients and things like that. So at conclusion, I want to say the understanding basic classification of patient types really helps clinician to assess patients' expectations and demands. Then expectations can be realistic or unrealistic, as we discussed, and it should be decided before starting any treatment. And no false promises. Don't give any false promises. Don't give anything which is like give you warranty, guarantee, and things like that. Be realistic and tell them this is how it's going to last. When I do any prosthesis, I do tell them a crown generally I say around it will last for around 10 years of time. And they have to go for the replacement. It's nothing like we are going to give a warranty or guarantee on that. If something goes wrong, definitely we give the service to them, but it's not that we are going to give a definite period of time that it's going to we are going to do everything free of cost in the future if something goes wrong. Then complex clinical situations can also be solved with meticulous planning utilizing these basic patient classification and basic principles what we have just discussed. This is about the presentation, and these are the references I took for this. And finally, I wish all of you have a happy dental practice with this understanding of patient types. And I thank once again Global Dental Professional, our group, for giving me this opportunity to speak on this topic. And I think Dr. Hilal, who's my batchmate, classmate, and a very close friend, he can add from his side if he wants to add anything. And Dr. Neha also can take up questions and we can have further discussion on this. Thank you so much. Have a
Thank you
great
so
day.
much, Fayaz sir. I now request Hilal sir to please add on few points.
Yeah, yeah. Can you hear me, all of you? Assalamu alaikum.
Yes, sir, we can hear you.
Yeah, yeah. Yeah, see, Fayaz has explained a wonderful presentation regarding all these things were about the classification and subject of philosophical, exacting, historical, what patients to take, what not to take. So he's done it very well. I can add a few things like, see, communication skill is very important before you start with the taking the patient. I think you need to explain him what you're going to do and what he can expect realistic, what is going to happen, than he being unrealistic and come back to us and argue with us, telling this is not proper, that is not proper, I have this issue and that issue. So communication skill plays a vital role. And second point is, I think we should always recognize the attitude of the patient. Hello.
Yes, sir, we are able to hear you.
Yeah, yeah. Can you hear me? You are able to hear me.
Yes, sir.
Yeah.
Yes.
Second is the attitude of the patient. So we should always see patient's behavior once he comes to your clinic, the way he communicates. One is the patient who comes through a reference will usually not argue much. Who comes through a strong reference, through a friend, or already a old patient who is coming, usually don't have attitude. Patients who are referred or who have gone through some other clinics and lot of they have some amount of psychological trauma, those people are definitely going to show some amount of attitude when they are initially coming to you for treatment. So always it's better we always communicate to them that this is what we are going to do and this will be the end result. I think more communication skills play a more vital role in this reading the mind of the patient.
Excuse me, sir.
Okay.
Hilal sir,
Yeah, yeah.
can you please
Yeah,
on
yeah.
your camera, sir?
Pardon, I can't hear you.
Can
Repeat.
you please on your camera?
No, I'm little outside. I cannot
Okay,
just
sir, no
add the
problem.
camera.
No
Okay.
problem.
Any doubt you
Sir,
can ask me.
yes, sir. I would like to ask a question. Sir, does our confidence and presentation to the patient plays a vital role in the behavior modification?
Yes, definitely. See, the confidence comes is what we speak to the patient, how we are communicating to the patient, how we are approaching, and how we are addressing his complaints. So, depending on that, I think our confidence is very important when we communicate to the patient.
Okay, sir. So
Okay.
shall start up with question and answer session.
Yeah, yeah. Please, please.
We have a question put up by Asim, sir. We have
Yeah.
seen female patients more exacting in nature, while male, and males have more indifferent attitude. What is your take on this? Can we have
Okay.
Fayaz or Hilal sir
Yeah,
answer,
yeah.
please?
So the females, especially, yes, definitely, especially, the hormonal changes and postmenopausal changes, they have a lot of health issues, especially the gingival health will take its own toll. So they have different, exacting type of like understanding what exactly is happening with them. So yes, uh, I really can't generally classify like male or female who's more exacting and things like that. But everybody will have their own issues, their own complaints, their own ideas. So definitely, maybe Doctor, who asked this question? Dr. Asim Basha sir.
Yes, sir. Asim, sir.
Yeah, okay. So maybe they would have experienced things like that in general, but yes, we really can't categorize who's more exacting or things like that. Yes, but I know that female tends to ask more questions. They tend to talk more, and it all depends on that. So that's one thing. So the males are more indifferent because especially the males who are working, they have mainly the financial constraints or the other constraints. They don't have time. They are busy in their professional life, their own problem. Some males having midlife crisis and things like that. All this lot of things will add on to it. That's a different topic altogether. But yes, on general, they'll have a bit of indifferent attitude, but but it's a very, very small percentage. So we see these kind of attitude in both male and female. That's what I see in my practice. If Dr. Hilal wants to add on something, and we can add, and we can also have Dr. Asim Basha sir. He wants to add something into this, and what is his opinion? What I said.
I think we can take Dr. Asim sir's suggestion also, as he is more experienced.
Yeah, because he's a senior practitioner. I think if we can take him, and because the question he has asked, I think he has something into it. So it's better to hear from him.
Asim sir, if you can please add on to it.
Yes. Hello. Assalamu alaikum, everybody.
Walaikum assalam, sir.
Yeah. Actually, there was a study which was done by Myers and in Boronolo and Midaskowski. They have done a study, I think so long back we have gone through the study. So in this also they told that females are more indifferent, and especially the post-menopausal females. These people are very demanding. And when they come to a clinic, so it's better we have our guard, or we keep our guard when we speak to them.
Okay.
Hello. Yeah.
Yes.
That this is what even my experience also. I'm very careful, especially postmenopausal females with hormonal problems, and especially females in 60-65 years of age group. Most of them, they'll be having their own phobias, own anxiety level will be very high in this type of female patients, and they'll be very demanding aesthetically. And on the whole, what happens is they don't want to show you. Their vision loss will be there. They'll also have this vision loss, and when we give them the trial denture or thing, you ask them to wear glasses.
Okay.
Most of them, they don't wear glasses, and then they wear it and they say yes, it's nice, and then afterwards, when they see it with glasses, this is also a problem I have faced personally.
Yes. Especially elderly patients or some patients having these aesthetic demands. You put a denture, yes, they agree, you satisfy them, you send them. The minute they go home, their children or their daughters or somebody, the daughter-in-laws or somebody will tell them, friends or somebody, that they are not looking nice. Suddenly the lips are, looking very bulgy and things like that. The face has changed. Again, they come back to you and they say, change the entire thing. That's where the problems will start. So it's always at the trial stage only for any prosthesis. Definitely do a trial. If it's a big prosthesis, don't do it final this thing. And sometimes you can give them and send it and ask them to come back and make sure they take it, properly, everything. I had one in UAE. I had a patient, was a complete denture patient, who used to tell me, or who used to go to my lab and ask the technician how to keep a tooth in the denture. So much exacting he was. And he visited 7 or 8 times to my technician, and he asked how to put premolar, molar, how to bite the teeth. I had to do 18 trials on him for just one denture. And finally, I took in writing after doing the 18th trial. I took in writing that he's satisfied. He's not going to make any more changes. And he took the denture. He was a good, knowledgeable, very nice patient, but he wants everything to be done in a proper way which he thinks is right. But he was not, like, dealing with such patients is very tricky. You have to really, that's where as Dr. Hilal mentioned, your communication skills are very important. Unfortunately, we are not given any importance to all this in our curriculum. So we have to really deal with. You have to prejudge everybody before you start the treatment, how they're going to behave, how they're going to take up, and all those things. So it's all become now practicing safely. That's what I can say at the end.
Thank you, Asim sir. We have another question. Few tips from your experience in increasing the submissive or fan patients, sir. This is put forward by Gausia, ma'am.
Sorry, how to handle your submissive or
few
patient
tips
who are your
from
fans?
your experience in increasing the submissive or fan patients.
Increasing.
Yes, sir.
Increasing
the submissive.
A lot of patients become your fans because of different reasons. If some doctor is smart like Dr. Nadeem, they just come to see him. So forget about the treatment. So, some patients like the dentist, they come and see them, and the way they look, they appear, the way they speak, this is the starting point. And again, once you start the treatment, how you handle it, especially when you go in pain or you go for some wisdom tooth extraction, you do it without pain and you do it nicely, then again, they become their fan, because, you have done excellent treatment without pain and you handle them. You, especially if the patient is very anxious, you handle them very nicely, talk to them, give them that TLC, the tender loving care. So they become very, very nice to you and become your fan. So it's all finally comes to, the basic human behavior, the humility we have. So we have to handle them in a very calm, composed way and do our job. We are not here to, make anybody fan or satisfy them, anything like that. We are not in that entertainment industry. We are practicing serious dental treatment on human beings. So we have to concentrate basically on that. So it's not that we are going to increase our fan base or something like that. We do our treatment properly, according to whatever, to our knowledge, our skill level, ethically, legally bound, safely. So definitely do our treatment to us. And patients coming and, talking to you nicely and things like that, then if you have more fan base, you have to give more discounts. Remember that.
There was another question for the same. How do you manage pressure from fan patients, especially when when their condition is compromised? And to this, I would also like to add on a question, sir. Nowadays, there are people who wants only fixed treatment. They don't want to go for any removable treatment, though their condition is compromised. So, in such cases, in patients, how do you exactly manage such patients? So, how do you convince them that fixed treatment is not possible in such cases?
No, what happens, doctor? We do land up in problem. A lot of patients who are very, very close to us come, or they bring their relatives telling that this doctor is really good. But when they come, you see a very, very bad situation in the mouth. For example, completely raw bridges you see, and they want something fixed. They don't want to wear dentures. They want some fixed solutions. It's not that you can't do it, but it's all about the skill level you can handle that kind of patient. These are like, terminal dentition patients where, you have to do full mouth extractions and, rehab them and things like that. So you have to understand these things will take time. So don't give them any false promises. And if you can't do it, take a professional help, refer them who can handle these kind of cases. So everybody wants to do something fixed. It can be done, but if there is no bone today, we can regenerate the bone, but it takes time. So terminal extraction cases, do the extractions and put them on dentures, then regenerate the bone and, go ahead with the fixed one. But everything requires proper meticulous planning, and it has to be given a realistic picture to them. It takes time if you want to do everything in a natural way to regenerate the bone naturally and do the fixed and things like that. But there are solutions. It's not that they are not solutions. You can definitely take a professional help if you're not able to handle that kind of difficult situations. So that's how we can handle them. But one thing is very, very important. Always speak very, very realistic. Always give the realistic picture. So we have to stick to that basic, principle which we have learned.
Okay,
And most of the patients will accept this, and some patients understand that this is not an easy job for a dentist or them to go through this treatment so much, and they will resort and they'll understand the limitation of this particular situation, their situation, and the damage which has been done over a period of time for them. So they'll understand that, then they have to compromise on the treatment.
how to justify a stance in scenarios where it's fault at the end from the laboratory?
This is a very, very big and important thing. We should have one webinar on communication with lab and how to deal with the laboratory. So the dental technician, especially in prosthodontics, I speak to my dental technician almost every day in the night, or WhatsApp chats and pictures sharing and things like that. So you have to work with a dental technician like a proper team, and he should know what exactly in your mind, and you should know what your technician can reproduce for yourself. So always have a very good technician, and speak to him and see what exactly you have to do. Communication is the key with the lab always, and don't always jump on stress the technicians, or raise your voice or scold them just because they are working under you. Just talk to them, make a good cordial relationship, and choose a good lab and good technicians and things like that. So many of the technicians we work, they really do good and understand their skill level up to what level they can work. But even technicians with a period of time, and with your understanding and handling, so definitely you can do a lot of things. Also, you should also know what exactly they're doing in the lab. You should know laboratory procedures yourself as a dentist. You can't just see a crown and fit it, and if it's not fitting, just blame on the lab. Look into what's really gone wrong, whether your preparation is wrong, you are not given the adequate clearance, why there is a high point, and all that you need to assess first yourself. Then you speak to the lab if it has to be corrected in the lab. If you can do small corrections there and manage it, polish it, or things like that, definitely you can do it. But uh, I I feel lab in as a dentist, you should know all the lab procedures. At least you should have done once what they're doing, so that you really understand what exactly the lab technicians are doing. So this is what is very, very important, and definitely it's a big another separate topic: communication with lab technicians and the labs.
I have a question,
If you
Dr.
want to
Fayaz.
Yeah, Dr. Nadeem.
Can I take up a question, Dr. Neha?
Yes, sir, we can.
Yes. First of all, very crisp and crystal presentation. You have done real justice to the topic what you have chosen. Alhamdulillah, Jazakallah khair for that. Now, regarding you spoke the classification of philosophical, historical, anxious, frightened. See, these array of patients are only seen during your a certain period of practice in your clinics or in your academics. So probably if I'm a fresher, if I have just come out in a year or two, I wouldn't know what is what, which class of patient, what I'm seeing. So peers like you who have already given a good insight what to look into for a patient, and that is important for us, which we have got through. So coming to the bottom line, when is the call taken by the dentist to all these categories of the patients what you have spoken, to say no, that I'm not going to treat you because you're too demanding? Can I take the liberty to tell them no, I cannot treat you? Or should I put it in a very subtle way and say that it cannot be done by me, it can be done by someone else, please go to the other dentist? How do you put that across? Dr. Hilal, Dr. Fayaz, anybody can take this question.
Yes, Dr. Hilal, you want to take, or should I?
Yeah, you take first, no problem. If you want, I'll add up something on
Dr.
that.
Nadeem, very, very good question you asked. And, this is where, we are, have to think about whole the system of patient management. So if you ask me, like you asked specifically for the youngsters, if they have just passed out and come, I trust me, if they have dealt with patient, or if they have dealt with other lot of people from outside world, they're dealing with difficult people, they have some communication skills. But a lot of kids who are very innocent, who have just finished studies, and they have come and they have to deal with these kind of patients, that's where they'll find a lot of problem. See, initially they asked me a question: the philosophical patient can become exacting patient after dental treatment goes wrong or go to the dentist. Yes, these classifications you cannot generalize and tell one patient will always be philosophical. They can change to the hysterical, or the exacting, or anything they want. If something goes wrong, or they can change their mental attitude or the behavior based on the experience also. Now, to answer your question, what I can say is, as a dentist, if you ask me personally which patient you will take, which patient you reject, see, I think if patient is giving me stress, asking unwanted things, questions, I feel I don't want to treat him. basically it comes to that. I don't want to take any stress because I have to give a treatment. I want everything to go professionally. It should be pleasure to meet people, talk to them and give treatment. It should be a nice thing, which should happen. If somebody is giving me stress, talking unwantedly, asking questions not related to treatment, they're fighting with me, they're too demanding, they're putting unrealistic demands, questions, they're asking me guarantee, warranty, and they say you're responsible for all this, then I'll say, I'm sorry, I just can't do it. Or in a nice way, probably, especially it also depends where exactly I'm practicing and things like that. So if there is a VIP patient or something, I put it forward. There's no VIP patient, I don't believe in that, but still, if the patient is come to you with a reference and things like that, if you think they're very, very spoken nicely, then you can easily put it across. You can go to some hospital, take a bigger help, or we don't have facility here, things like that. But some patient, if you really feel, then you can really give back. That all comes with experience, maturity, and with the age, and we learn all these things. So every day is a learning for us. So dealing with patients. So as I said, especially in this part of the world where I'm practicing, we try to be very careful and things like that. We don't want to do any aggressive procedures, which probably I might take up in Bangalore and doing full mouth rehabs and things like that, which are, very aggressive and very aggressive plans and things like that. But you have to be very careful. But at the end of the day, if something is stressing me, I don't want to do it. That's all. And what stress level you can take, it's up to you. Probably you can do 5-6 root canals in a day, which I can't do. So that's stressful to me. If the patient is coming and demanding to you, probably you can take it up and do it in single sitting, which I can't do. So I'll not take up such cases. It all depends on individual dentists, but I say stress level is very, very important. If the patient is coming and stressing you too much and you can't take up, don't take such cases. Say no. Learn to say no.
Yeah, that's
Dr.
good.
Hilal, you
I
want to
think,
add something?
Dr. Hilal, I think just
I
to add
think
that,
directly,
just to add that,
directly telling the patient, I will not do the treatment. I think it's disheartening for the dentist himself. I think it's better you explain him what is realistic and what can be actually done to him rather than directly telling him it's not possible. You can go to some other dentist or some other clinic or some other hospital. Always you can take support of a good specialist or your friends and do the needful to the patient.
the stress levels are highest. What I have seen is during complete denture cases. I hope you guys agree with that.
Yeah. Especially old
Yes,
denture patient. Yeah,
exactly,
especially the old denture patient.
exactly. You happen to see the patient 2 times, 3
Yes,
times, 4 times, the denture
yes.
adjustment. On the 5th time, you literally want a back door where you want to run away, and the patient the moment he enters in the front door. So that is this has been the highlight of this topic. What I wanted to convey is these old patients, see, they are so dependent on the dentist when they come to you, thinking that they can get a denture. Apart from the aesthetic part, they would like to masticate nicely, chew their food nicely, but end of the day, when we don't deliver, and whatever said and
Even
done,
one more
I know there are a few intricacies involved in the ridge issues and everything, but again, we are not able to deliver. Is that we have to say, this is what I could do from my side, and this is the end of the story. Please be happy with what you have now. This is how we are going to put it across.
See, you should tell him how much of his ridge is compromised and what is the maximum retention you can achieve. If you have really expectation of high, you might have to go for implants if your bone is favorable. Or you can always add on adhesives to the patient, convince him to use it so that you will definitely be improving the retention of the denture of the patient.
So I would also like to add a question
Yeah,
here.
please. Yeah.
In case of complete dentures, though the patient would be satisfied, the relatives who are accompanying the patients, I think they try to create, a problem for us. They, aesthetic wise, especially when it comes to anteriors. So is it better to deal with only patients alone, sir, in case of complete dentures, rather than allowing the relatives to accompany them into the
No.
cabinet? I mean.
See, when it comes to aesthetics, it is always better to ask the patient to come with 1 or 2 companions who are very favorable or who are always with him. Because those people will be the one who will always tell him you're looking good or you're looking bad. So that will definitely affect the psychology of the patient who is wearing the denture. So it's always better that the stage of trial is most important when you're doing a complete denture when it comes to aesthetics. So you should always show them once, twice, and thrice in the mirror. Discuss with them, discuss with their companion. Are you happy with the teeth size, teeth color, position of the teeth? And only then you go with the final fabrication. That is what I can tell you. The best thing what you can do when they come back with the problems of aesthetics, you can always tell them this was shown to you before and now nothing can be changed when it is fabricated. That should be conveyed clearly to the patient before you go with the fabrication.
Okay, sir. We have other
Yeah, I just want to add this thing. Dr. Nadeem said very nicely that we do a complete denture and patients keep coming for repeatedly for adjusting. So you can always say, see, if one or two adjustments are free of cost, you can definitely do it. But if the adjustments go on beyond, they start coming for small things, then you can definitely say that, you know, each adjustment will take some, you know, at least consultation charges. That's when they stop avoiding. Some patients keep coming and trim here, trim there. You know, all that, you know, do happen, but make sure you're not easily available. Make sure it's not that once they are paid, you're always free for them or something like that. In complete dentures, it's really difficult. But again, in complete denture, when it comes to question of retention, I always suggest at least place 2 implants, convert all your complete denture cases into over denture cases, especially for the mandibular ridges. If it is resorbed ridge, no problem. Especially in the anterior mandible, definitely there'll be bone. So you can put 2 implants and stabilize the denture. So I don't think so. If you practice basic implantology, at least the retention of a denture shouldn't be a problem, because you can definitely add on 1 or 2 implants, which has become standard of care in most of the developed countries now. You just can't give complete denture. Minimum 2 implants have to be placed and given until and unless there is a big problem for the implant placement. With conditions, but definitely that's the standard of care. You should always give whatever best possible with the, you know, kind of scenarios you have.
Sir, another question. Is language a barrier in communicating? If so, then how to deal with that? Would a translator be able to justify with the dentist what the dentist is trying to convey?
Language is very important. So language connects the people, language connects emotions, language connects feelings. So language is very important. So it gives that, you know, feeling of comfort, feeling of trust if you speak their language. So always, if you are not able to speak what language they understand, at least make sure you have a proper, translator with you, and make sure without a translator, don't speak to the patients, and always, explain to them what exactly you want to explain. So make sure, everything goes well. This is a very important, especially when you don't know the language. That's what the problem starts, especially when we come and practice here. We don't know Arabic, but we have learned it now. But we always used to have our translator who speaks to them and everything, especially some people who, they want to speak, they want to hear from you as a doctor and things like that. So communication is very important. If you don't know the language, always have a translator. That's really important. Next question.
1 minute. Will additional aid of graphoanalysis help?
Sorry?
Will additional aid of graphoanalysis help?
You mean to say the
It's put
good
forward by
cases
Asim,
for complete
sir.
denture? Sorry?
Put forward by Asim, sir. If Asim, sir, can please ask directly this question, sir.
Graph analyzer?
No, grapho analysis. That is, you give them a form and ask them to fill it up and see their handwriting. Will that help in identifying difficult patients?
Yes, it might help, but I'm not a very good handwriting expert to understand the psychology of a patient seeing the
At least
handwriting.
basic.
But what is it about, Dr. Asim sir, you're asking about? Can you have some throw some light on this?
Grapho analysis. At least basic strokes we can understand, and if our dentist can catch up that, and we can know these patients are difficult, ask them to write something and then make out some, like basic strokes, basic T
Okay.
or P and all like
Yeah.
that.
Yeah.
At least if they have, our dentists have knowledge of that, they can at
Yeah.
least identify this is a difficult patient and have to approach it in a different way.
Yeah, that's quite interesting, and we should all learn about this technique. Something new to us actually. But yeah, I know something is there like handwriting experts and things like that. But thank you for letting us know this new thing, new technique to understand. We can understand what kind of person he's basically with the strokes they give.
Yes, yes.
Okay.
I think Asim sir has asked another question about face reading. Will face reading help? As in sir's experience, prominent lower lip, pointed nose, large ears, small eyes are demanding. What's your take on this, sir?
Is it sir, are you talking about Asim sir is a astrologer, I think. But he does also speaks about just seeing the x-rays. He says the age of the patient, male, female, and everything. I don't know how he says all this, but it's always surprising to me how he concludes all this. But as some people can, whatever he said, like those are the findings, maybe some studies would have published or some things like that. But I'm not a definitely face reader. I don't even know how to read the hand also. So Asim sir only should throw some light. He is the best person who has asked this question. So what is that your
No, face reading is a physiognomy. It's a science, actually, basically a science where there's a lot of data review. Like, for example, lower prominent lip. When patients come with lower prominent lip, they're like demanding patients. And I see class 2 diff 2s are very timid patients, and oral breathers are patients like, I'll give them anything, they will take. They don't have so much of energy. They say, okay, fine, go ahead. Even they don't bargain. If you see an oral breather and you do it, they don't even, they don't even ask you the treatment plan. They're ready to pay you. So these things, what we usually we see in the clinic.
Oral mouth breathers, okay.
Mouth breathers, yes.
Oh, that's a nice finding, Aisha. I'll keep it in this mind and look into it when I present a plan next time for
small eyes. They're very demanding. Usually, when patient come with very small eyes, I see them when I'm placing the crowns and all. They are very particular about the aesthetic part. Even the small angles also they'll catch. This angle is different.
Small
that
eyes.
Angle, yes.
Small eyes. They make their eyes small and observe it carefully.
Pointed nose, large ears, broad forehead. These are usually, that's how you can catch up with them.
Okay.
And Dr. Asim, I have all of these, yeah.
This is really interesting.
I think I can handle you better, Nadeem. That's the reason.
This is something very new to us. We never learned all this in any textbook.
No, these are small things which we dentists should be trained,
Yes.
And when they come, they can tell them, actually, this is a difficult patient. This is this type of patient we can make out. Their professional, their educational backgrounds.
Yeah.
The street smart patients, the chalu type patients, especially the patients who are in the market. Ekka, these type of patients, they are very, you have to tackle them. Even I cannot tackle them sometimes.
Yes.
So can I go to the question?
Nice thing. Yeah.
We have a question by Arsha ma'am. In the Google era, most patients do a lot of reading before coming to you. How do you deal with them?
Dr. Arsha Khalid, right?
Yes, ma'am. Yes, sir. From Arsha ma'am.
Yeah. She's my classmate. I think in the other group I saw it's her birthday today. Happy birthday, Arsha.
Thank you.
Yeah. So she asked me about the Google masters.
How do we deal with such patients?
So yes, it's a very, very common problem now. Everybody, goes and Google it. Even patients, even take it as even if we want to go something, we Google it. It's become a very, basic habit or part of our life. Looking into Google for everything and things like that. Again, as I say, you stick to your principles. Let them have whatever Google research they have. Let them have a complete thesis on it. Let them learn everything, proceed. But whatever it is, as a professional, we should know what exactly we're doing. When you present a treatment plan, present it in such a way that wherever they go and see and everything, they should find a proper relevance to it. Don't give unrealistic plans and things like that. Whatever the clinical situation is, look into it, understand, analyze, and give a realistic plan which you can achieve it. And don't give unrealistic plans. So yes, definitely they Google it and they come, but we can't help it. That's how all the patients are today's world, and it's going to increase in future because these kind of things are not going to go down. It's going to become more and more. I'm very sure about it. So COVID has taught us how to do the online consultations, which was never there before earlier much. So things are changing, and definitely in coming days more things will change because technology is going up. So all these things we have to look into and stick to your basic principles. That's all I can say. If Dr. Asim or Dr. Hilal wants to add something on this.
No, Fayaz, that's good, very good presentation, and I think most of the questions also are answered. If anyone have any more doubts,
So
they
one
can
more
always.
question by Asmat ma'am. Have you come across medical legal cases and how did you handle it?
Actually, personally, I have not come across any medical legal cases, but definitely I've heard through some of my friend circles about these cases. So always it's better you have that indemnity bond or something what we call legal, so that legal issues will be taken care of them. Second thing is we always tell always to have the format in the clinic, take their permission with the procedure what you're going and what all complications can arise. Take the signatures and keep it along with you in a file, so that any day it is always helpful for you to take any legal proceedings or any other things come across.
Very right. And please understand the local laws, the legal system which is there in the area or the place or the country you're practicing. Please understand that what kind of system, healthcare system is there, how strict it is, and how lenient it is. And never ever do any procedure which is beyond your scope or the skill or the limitation. So always stick to whatever the qualification you have. Maybe you're more skillful to do procedures more than your qualification, but sometimes it might backfire you. So make sure whatever your qualification is there, which is there on the paper, make sure you stick to that level only. Don't try and do something which is extra, which might backfire you sometimes. So you have to be extremely careful. So as I said, it is always a safe practice now. So make sure we deliver perfect things to the patient. So medical legal, yes, personally, I also have not come across anything which was, put a complaint on me or something like that. But still, there are instances where patients have told us that, they are going to complain or do something, but never happened in one or two cases. But be careful about this. This is one area where nobody wants to, get into as a practitioner.
I think we are done with the question and answer session. Anyone have any doubts? Any more questions?
I think we are done. So we can conclude the session.
Thanks is such a little word, not more than a minute, but has a huge depth of appreciation in it. I owe a special gratitude to global dental professionals for organizing today's webinar, and Dr. Fayaz sir and Dr. Hilal sir for sharing their immense knowledge. Last but not the least, I thank all the doctors who attended today's webinar. Let our zeal and quest for ilm keep increasing. Jazakallah khair, and hope to see everyone in coming next webinars.